So as with most of pre-med preparation, I think when you're thinking about your primary application, thinking ahead is always a really, really good idea. So what are some things in your primary app that you should really start thinking ahead about? Your personal statement, one, and then two, your letters of recommendation. So when I came in as a freshman to college, I met this upperclassman who told me, you know what, just get yourself a journal and tell yourself it's going to be your personal statement journal. And I did. So you'll be surprised how you'll just have moments throughout a day in your life and you just need to jot something down that you think will be so powerful for your personal statement. And I thought that was such a great practice for me, because by the time I needed to start writing my personal statement, I really had a lot of great writing material to work with, just great epiphanies that I had throughout my few years at college. So I think jotting down important stuff throughout the years in college for your personal statement is really valuable. So in addition to just collecting your ideas over time for your personal statement, it's also really important to get a lot of people looking at your draft. So you might have heard from older students that they had about 15 to 20 versions of their personal statement, and that is not an exaggeration. You just end up scrapping a draft, maybe keeping a few paragraphs, but ultimately really changing the angle of your personal statement. Because we're diverse beings, so we change where we're going with our personal statement. So try to think over time about who you're going to show your personal statement to. So good people to show them to would be current med students who successfully got in. If you know any faculty on admissions anywhere across the country, that would be really great to get them to look at it, because they're the ones who actually look through personal statements and they know what they're looking for. So if you have any connections like that, that would be really helpful. So personal statement is definitely crucial for your primary application, but what's also really crucial is the faculty recommendations that you get. So many faculty have templates for their letters of recommendation, and they just change a name here and send it out. And what you really don't want is one of those lackluster basic recommendations. And a basic recommendation is this student will definitely succeed in med school. That's a basic sentence and a basic recommendation. You need to really shine and stand out amongst these thousands of applications, right? So working on creating long-term relationships with faculty is really important. That might make you think about getting involved with research early or going to office hours a lot. Definitely important when it comes to faculty recommendations. And the other important part about your primary application is that you get to choose 3 activities that you feel were the most important of your undergraduate career. So my advice for those is to, once again, really try to stand out with those. So if TAing is really a big part of your life as an undergraduate, sure, choose that as one of your 3 important activities, but just realize that about 60 to 70% of most applicants do TA. So that's not really too unique. So if you can find a unique leadership activity that you did, then you'll really stand out in your application process. So when it comes to secondary applications, you'd be surprised how important sending those in a timely manner really is. So schools, I believe they do this, but they do look at the turnaround time between when you submit your primary and when you submit your secondary. So what's really cool about secondaries actually is that schools don't change them much from year to year. So you can actually just look up all of last year's cycles, secondary questions, and pre-write them. So you can get them ready ahead of time so that as soon as you get a secondary from a school, you might even be able to submit it that day. And if you do that, you're telling the school, I really care about this program. I'm really interested, and they do take that seriously. I think they really value a quick turnaround time with your secondaries. So writing secondaries can seem a bit tedious, and you just got to get down to researching the school really well. And my advice for that is try not to look up the basic stuff. If you can find unique things about a program that really set it apart from other programs, which can be hard to find out. Sometimes you're going to have to talk to students currently at the school or faculty at the school to really find out what makes the school different. But if you bring up stuff like that in your secondary answers, then you're really going to stand out. And when admissions is looking at your application, they're going to say this person is really going to value this school, and they're going to thus want to accept you and interview you even more. So that's kind of my advice to secondaries, that you can jump the gun with them, and you should also try to submit them as quickly as possible. Also be sure to not copy and paste answers for each school. I know it can be really tempting to kind of just use a few paragraphs as a template for your secondaries, but just start from scratch for each one, because if you copy and paste and you forget to change the school name, then you're just going to be immediately rejected. So just be thoughtful about your secondaries. I think you can go a really long way in your application process. So if you do get the chance to be interviewed at medical schools, usually they set it up that you'll have one faculty interview that'll last around like 45 minutes to an hour. And then most schools will have you be interviewed by a current student. It's usually like a second year medical student, usually like during the afternoon in your day. And it'll be about like 30 to 45 minutes. So that definitely reflects most of my interviews. Some schools do also follow the MMI format, which stands for multiple mini interview. So these usually involve they are kind of daunting, but sometimes you'll deal with patient cases and kind of hands-on problem solving. So I definitely utilized Emory's Career Center for that. They had all of these mock interview workshops that I signed up for immediately and made sure that I practiced those before I actually went on any interviews. So talk to your undergraduate program and find out if there's any type of resources you have when it comes to practicing interviews. I know that my school also gave me worksheets and worksheets of potential questions I could be asked, and I definitely spent my time jotting down thoughts and bullet points as to how I would answer them. So I would also advise you to not directly rehearse everything, because if you come in sounding like a robot on your interview day, that really is almost an immediate rejection, because as physicians, we need to be humans, right? So we need to communicate like real people. So avoid over-rehearsing your questions. It's okay to stumble a bit when you're in your interview. They understand you're nervous, and they understand that the stakes are really high. So come in and be your true self with some prep beforehand, definitely. An important preparation for interviews as well is to have a few questions ready to ask at the end, especially with your faculty interview, because if you have questions that you have ready to ask, then it shows you're really interested in the program, and they do take that very seriously. One other piece of advice that I wish I had kind of thought about during my interview cycle is that if you have the chance to be interviewed by some of your top choice schools, like your dream schools, try to schedule those interviews maybe a bit later into the interview cycle once you've gotten a few interviews under your belt. So my first interview was in September, and it was my first choice school. So I went into my first interview day trying everything for the first time at my first choice school. And I was ultimately waitlisted there, and I ultimately think that it was because my interview was not so fantastic as it was by my last interview, which was in February. As I think now back to my September versus February interview, I know that I was much, much better coming into February. So think about how you want to schedule your interviews, because I think planning your safety schools a bit earlier to get interview practice in is really good. It could help you out, and maybe you won't get waitlisted at some of your top choice med schools. Some people may forget this, but dress professionally on your interview day. Most people did during my interviews, but I noticed a few who looked maybe a bit too disheveled or not so put together, and I think it does go a long way to come dressed very, very well. I know that everyone's not a huge fan of the Student Doctor Network, but this SDN, the website online, has great forums as far as dress for men and dress for women for their interview day. Just so many people are talking about what to wear, what not to wear, discussing makeup, hairstyles, ties, bow ties, shoe color. Some people will tell you never wear black or never wear blue, but so do some research and figure out what you want to wear. Definitely be comfortable. That's most important on your interview day. Make sure to iron your clothes and all that good stuff. And I think if you can practice your interview skills with some friends or maybe even faculty, that can also go a really long way. And lastly, I think on your interview day, just be confident, because the fact that you're getting invited for your interview is already a huge accomplishment, right? if they are inviting you for an interview, they're saying that you could definitely come here and you are totally capable of succeeding at this med school. And now we're just trying to figure out if you're a really good fit for this school. So that also reminds me that what you're to tell you guys that trying to convince admissions that you're a great fit for the school is your priority when you're going in there for an interview. So even if you feel like you're not the personality type for this school, if you feel like it's too nerdy for you or it's too outgoing for you, you need to mold yourself to that school to increase the chances of getting accepted there. So try to really focus on telling admissions that I'm a good fit for this school when you're coming in for your interview day.